Welcome to the Therapeutic Foster Care Training Resource Toolkit webinar. Today's webinar will focus on understanding the difference between ISFC and, today's focus will focus on the TFC Toolkit. The webinar is part of CIBHS's technical assistance work with the Department of Healthcare Services. Today's content is designed to help county mental health plans, foster family agencies, and other providers in understanding how to use the TFC Toolkit and point out the resources available for your agency. So before we begin, we have two polling questions we would like you to answer. This helps us get a better understanding of our audience today. If you're logged into a computer, you can click on your response after each question, and we will also share the responses with you. So first, please tell us what area you represent: child welfare, behavioral or mental health, contract agency, CBO provider, juvenile probation, or other. So the poll is now open. We'll be closing the poll in just a minute. Okay, we're getting ready to close the poll, and Kelly will tell us what our responses are.
We had 19% from child welfare, 47% from behavioral and mental health, 28% from contract agencies, CBOs, and providers, no one here from probation, and 7% other.
Great. All right, so we're going to go to our second question, which is, please let us know your agency's current status around implementing therapeutic foster care, or TFC. Not implementing TFC, planning to implement TFC, we currently provide TFC, or not applicable. So the poll is now open. So go ahead and click on your answer. Closing the poll in a few seconds. Okay, and you want to read the answers for us?
Sure. There's about 20% of people not implementing TFC, 52% of people are planning to implement, and 10% of people are currently providing TFC, and 18% is not applicable.
All right, thanks. So as we move on, I want to present my co-presenter today, Dr. Karen Kurosaki. Karen is a consultant to CIBHS and was the lead writer on the toolkit. We're also joined today by Cindy Colkin from DHCS, who is lead staff for therapeutic foster care for DHCS. Karen and I will be alternating presenting throughout the webinar, and we also will have time at the end of the webinar for questions. So these are our objectives for the day today. We want to review the TFC toolkit and the intended purpose and use. We will review the required TFC parent training topics. We will review the TFC parent training areas, and we will discuss learning objectives for each training topic. Finally, we're also going to share some of the training resources available in the toolkit. And if you haven't already done so, we suggest that you download the TFC toolkit because we will be looking at it throughout the webinar. These are some additional resources that will be helpful for you to have access to either now or later after the webinar. Number one, the toolkit with the link to it there. Also, we have the information notice 17-009, which is a TFC service model and parent qualifications information. That was also updated in February of 2017. The Medi-Cal manual for intensive care coordination and IHBS and therapeutic foster care for Medi-Cal beneficiaries, the third edition of that. And finally, we did a webinar recently on therapeutic foster care and intensive services foster care, and that link is also available, and you may want to listen to that too, because that gives information about a crosswalk and the differences between the two different types of programs. So the other thing is that we want to remember that you have is that there are 40 hours of initial training and then a minimum of 24 hours of annual training after that.
All right, so here you see an overview of the key steps taken to develop the toolkit. And we wanted to share this with you because it was a really robust process with stakeholder involvement. So we convened an expert work group comprised of a breadth of relevant perspectives. We heard from former foster youth, foster parents, numerous advocacy organizations, for instance, the California Alliance of Child and Family Services and the California Alliance of Caregivers, the attorneys representing the plaintiffs in the KDA settlement, foster family agencies, local county agencies that serve foster children and youth, for instance, child welfare, county mental health plans, and juvenile probation, and state agencies involved in advocating for or setting policies that affect foster children and youth, Child Welfare Directors Association, the County Behavioral Health Directors Association of California, Chief Probation Officers of California, California Department of Social Services, and the California Department of Health Care Services. The work group took a careful look at the 18 required pre-service TFC parent training topics and felt that they could be organized nicely under 8 training areas. The work group also took on the task of writing learning objectives for each of the required 18 pre-service TFC parent training topics. Additionally, the work group made recommendations for what resources they considered to be useful for TFC agencies embarking on the task of designing a TFC parent training program. So for example, they recommended clearinghouses and other websites that had posted things like training curricula, course syllabi, or course descriptions of potentially relevant trainings. The work group also recommended certain evidence-based, evidence-informed, and promising practices. And so through an iterative process, we researched those recommendations and then brought them back to the work group for further vetting and recommendations. So the work group convened multiple times over the course of just 4 months and yet accomplished all of this. So needless to say, the work was very intense because it was a lot to accomplish in a very short amount of time. And so I just want to say that the subject matter experts on the work group were just amazing to work with. They rolled up their sleeves at each meeting, came and did much of the crafting and writing of the learning objectives. And it was a dynamic process where I took their work and refined it and then brought it back to them and went back and forth in that manner. And in the end, we were all very pleased with the outcome and proud of what we produced. So that was the process. And then DHCS performed the final vetting. Now, we'll talk about the toolkit itself. And what we're going to cover next is how to use the toolkit. And then we'll go over the required 18 pre-service training topics, the 8 training areas under which the required 18 pre-service training topics were grouped. We'll also review the TFC learning objectives for each of the required 18 pre-service training topics, and then we'll go over some of the resources that are in the toolkit that the expert work group felt were beneficial to include. Let's look now at how to use the toolkit. The toolkit is intended to serve as a resource for TFC agencies developing their TFC parent training programs. And I think the key word here is resource. So I just wanted to underscore that. The toolkit was created as a resource and it is not a policy. TFC agencies should conduct their own review and vetting of all resources. You know, each agency has their own training for resource parents already. They have an understanding of the parents' needs for training, and so each agency should review the material and vet it so that it incorporates, they can incorporate it into existing training programs and make it work for them and for their parents. TFC agencies will need to also consider the effectiveness of various learning methods for the parents that they are going to be training. And clinical expertise and the consideration of client values should, of course, be incorporated into training curricula decisions, including for those that are evidence-based, evidence-informed, and promising practices. And this is really important. I'd like to stress this, that TFC agencies should consult with the county mental health plans, or the MHP, with whom they are contracted or are in the process of obtaining a contract as they develop their training programs. So ultimately, the MHP is going to be the approver of the TFC parent training program that the TFC agency develops. And so I want to just stress the importance and the value of consulting with the MHP early so that you are both on the same page as you develop the training program. And finally, the toolkit is not an endorsement by DHCS or by CDSS of any particular training resource, and it's not a directive that these must be used. So again, it is a resource.
So now we're going to get into the next part of our webinar, which is to look at the 18 required pre-service TFC training topics, which are listed in the information notice number 17-009, and then organizes under 8 broad categories to see how the training topics relate to each other. And one thing to remember that Karen may have mentioned already is that foster family agencies may already offer training on some of these topics as part of their existing training for resource parents. And you may wish to consider how those existing trainings or topics could potentially be repurposed or modified to meet the needs of TFC parents. So we just wanted to make sure you thought about that. So the 8 training areas are Introduction to Therapeutic Foster Care and the Service System, Understanding Child and Adolescent Development and the Appropriate Interventions for that, Working with Children and Youth Using a Trauma-Informed Approach, Preventing and Managing a Crisis. And we're going on to the next slide, which gives the remaining of the 8 topics. Communication with children and youth and families, cultural competency, client sensitivity, and training around stress and well-being and self-care.
All right, so here you see the training topics, the 18 pre-service training topics, and how they've been organized under those 8 training areas. So starting with 1.0, Introduction to TFC and the Service System, you'll see that there are 7 training topics that have been grouped under that first training area. So I'll just read them. 1.1 is the Introduction to TFC and the TFC parent role in mental health treatment planning. 1.2 is involvement and role in child and family teams. 1.3, Introduction to Individualized Mental Health Treatment of Children. 1.4, Access to Other Medically Necessary Specialty Mental Health Services. 1.5 is HIPAA. 1.6 is Progress Note Training and Medical Necessity Criteria. And 1.7, Understanding and Monitoring Medications. Next we have the second training area, and under there we have grouped 2 of those required training topics. So you see there we have developmental stages and age-appropriate interventions, and also working with children who have been abused, neglected, and or delinquent.
Under the third training area, which is working with children and youth using a trauma-informed approach, we've categorized 3 of the required pre-service training topics. So those are trauma-informed care, positive behavioral reinforcement techniques, and finally behavior management techniques. So going on to the 4th training area, which is preventing and managing a crisis, we have 2 of the required training topics under there. That would be prevention of aggressive behavior and de-escalation techniques, and crisis management / de-escalation techniques. And then under the 5th training area, which is communication with children and youth and families, there is 1 training topic. That's effective communication and relationship building techniques. And I should have mentioned that these are pages 5 to 6 in the actual toolkit. So if you have that in front of you or plan to download it later, that's where you will find these. So continuing on to the 6th training area, that's cultural competency. And under there we have 1 of the required pre-service training topics, cultural competence and culturally responsive services. Under the 7th training area, client sensitivity, we put under there 1 of the 18 pre-service training topics, and that's client sensitivity training, including stories and content developed and delivered by peer roles, for instance, foster parents, former foster youth, and biological parents. And finally, the 8th training area is parent self-care, and under there is 1 of the required pre-service training topics, training around stress and well-being, self-care. So you can see how those groupings were done. Now, we are going to go on here to look at the learning objectives that were crafted for each of the training topics. So those will be found in your toolkit, pages 7 through 17. And one thing that you'll notice is that the learning objectives were written so that some address knowledge and others address skill acquisition, and then others address attitudes. So knowledge, skills, and attitudes that are expected to be acquired, that is, as a result of the training. So that was deliberate. All of the subject matter experts agreed that the learning objectives needed to go beyond just knowledge. So you'll notice that they were written also from a trauma-informed and also a person-centered perspective. All right, so I'm just going to walk through a couple examples from the toolkit. So we're going to start with involvement and role in child and family team. Kim, I'll hand it over to you for that.
So again, here is the learning objectives for this area, which is, so remember again, we're looking at training topics and learning objectives that we want the parent to be able to demonstrate knowledge, skills, and abilities, and a way to be able to handle this work and to do the work. So the first learning objective that our group developed was to describe how TFC must be delivered using a child and family team to develop and guide the planning and service delivery process. And the second learning objective for that was to describe the TFC parent's responsibility to participate as a member in the child and family team in care planning, monitoring, and the review process. So continuing with this objective, other ones were to, number 3 was to demonstrate the ability to observe, monitor, and appropriately communicate with the Therapeutic Foster Care Agency and members of the CFT, including in the presence of the birth parent, about changes in the youth or child's needs. The fourth learning objective, pardon me, under this area is to demonstrate an understanding of the dual role of the TFC parent to create a safe family environment for the child or youth, while also delivering a clinical service and serving in a professional role on the child and family team to help the child or youth achieve identified treatment goals. So next, we have developmental stages and age-appropriate interventions. So this topic covers negative effects of abuse, neglect, trauma, loss on the healthy child and adolescent development, as well as the skills needed to intervene appropriately with children and for youth who are not expected developmental milestones. So our goal here is that as a result of this training, we would expect the TFC parent to be able to handle the following things. And so here's the learning objective for that, which is to describe normal child and adolescent development milestones, and along with the negative effects of abuse, neglect, trauma, and loss on a healthy development. Going on to 2.1 about developmental stages and age-appropriate interventions, the learning objectives continue, describe normal child and adolescent development and milestones, and the negative effects of abuse, neglect, trauma, and loss on healthy development. We want parents to be able to describe the basic concepts of attachment theory, the negative effects of abuse, neglect, trauma, and loss on developing healthy emotional attachments. And finally, the third learning objective here is to be able to recognize indicators for children and youth who are not meeting expected developmental milestones and describes for how you can seek assistance. So again, these are just a couple of examples that we're sharing with you. And remember, as you look at the toolkit, these are the learning objectives, and you may have existing trainings that cover this. You have trainings that maybe you could modify, or as you seek training for your therapeutic foster care parents, remember that these are the areas to look at the learning objectives. So make sure you look at the learning objectives for all the different topics and areas.
Thank you, Kim, for walking us through those examples. So as you look at the toolkit, either in front of you today or after the webinar, you'll see that the different training topics don't have the same number of learning objectives under each of them. Obviously, the nature of each training topic kind of dictated the number of learning objectives that were needed. So they range from 3 learning objectives at the fewest, and at the most there's one training topic that has as many as 8 learning objectives, most of them around 5, 6, or maybe 7. All right, so let's now go on to the clearinghouse resources. So in the next section, so we're moving out of the training topics and the training areas and learning objectives and going to the training resources section. So on pages 18 through 20 in the toolkit, you'll see a section that is a list of several clearinghouses. Now, clearinghouses are an agency, an organization that collects and distributes resources. So I wanted to just point out here that the resources in this section are not necessarily vetted to ensure that the information, the interventions, and so forth are Medi-Cal billable activities. So it will be the responsibility of the TFC agency to understand which activities or interventions are or are not billable to Medi-Cal. Also, another thing to point out is that the list is in no way exhaustive. It should be thought of as a starting point to support your efforts in developing your training program for TFC parents. So again, clearinghouses is the first in this section, and there are links to clearinghouse websites with trainings that are relevant to child welfare and for practices and interventions that target specific behaviors and conditions that may be relevant to implementing TFC. So here we have a list of those that are in the toolkit: California Evidence-Based Clearinghouse on Child Welfare. We also included the National Adoption Competency Mental Health Training Initiative. We included the National Child Traumatic Stress Network, also the Quality Parenting Initiative, and we included SAMHSA and REPS.
And also if you move on, there's some additional resources that we've identified that train foster parents who may have training resources. Some of these have identified curriculum or are actual courses, as in the Foster Parent College, which is an online program. So here we have CalSWEC, which is the California Social Work Education Center, Foster and Kinship Care Education through community colleges, and then also the online Foster Parent College. So again, these are more examples of potential resources that may be helpful to you as you're developing training for therapeutic foster care.
So the next section in the toolkit is other resources, starts on page 22. And in this section, we have included practice models that have been developed outside of California. We recognize that because these were developed outside of California, that the models may not necessarily conform exactly to California's integrated core practice model or California Medi-Cal billing requirements. But our subject matter experts wanted to make sure that they were included. Some of them have been implemented in California, and these programs use evidence-based and evidence-informed models as part of their programs. So the first is the Program Standards for Treatment Foster Care. So FFTA published a set of standards in 2013 to assist agencies in the development of quality treatment foster care services for children, youth, and families. And this resource covers a broad framework, including standards for programs and agencies, treatment parents, and children, youth, and their families, and includes a self-assessment tool. We've also included Presley Ridge's Treatment Foster Care Program. So this program is designed to provide intensive, effective, and short-term treatment to children and youth with emotional and behavior problems in a home environment with the foster parent as the primary agent of change. The model uses treatment foster parents who are given advanced clinical and technical training and support to best serve the youth placed in their homes. The third one is Together Facing the Challenge. Together Facing the Challenge is a training consultation approach to improving practice in treatment foster care. This intervention was built from a naturalistic study of usual care for treatment foster care to determine what practice components were related to improved outcomes for children and youth. It also incorporates elements from existing evidence-based treatments to fill identified gaps in usual care practice. The resulting model includes training and consultation for treatment foster care supervisors, as well as training for treatment foster parents. The model is designed as a train-the-trainer approach so that treatment foster care administrative and supervisory personnel can learn the training and model and train treatment foster parents. So again, that's a train-the-trainer approach. And finally, we have Treatment Foster Care Oregon, or TFCO, and this is a multifaceted intervention comprised of the following components: behavioral parent training and support for TFCO foster parents, family therapy for biological parents or other aftercare permanency resources, skills trainings for children and youth, supportive therapy for the children and youth, and school-based behavioral interventions and academic support, and psychiatric consultation and medication management when needed.
So the other, as you move through the toolkit, we have selected resources listed by training topics, and we have short abstracts that cover key information for different topics, such as the name or the title of the training, the developer's name and the URL, the area of focus, the target audience, the aims of the training or resource, its theoretical base, any supporting evidence, the teaching format, whether that's in person or online or a train-the-trainer model, the length, the cost, and whether that's a cost either per person or whether it's a cost to work with an agency or a developer to provide that training to you. If there are teaching materials available or included that you can download or not, or if that's part of the cost that you pay for, and if there's any copyright information. So we encourage you to think about, that's the way we approach this, so that we could basically give that snapshot of information to you. And what we're going to do is just look at a couple of the examples of these resources with the abstract. So if you look at page 27, so here's an example of family engagement and child welfare video series from the National Technical Assistance and Evaluation Center for Systems of Care. So what this does is you'll notice there's a link. You can click on the link, and it basically gives you information about experiences of 2 systems of care communities that work with birth parents and relative caregivers in paraprofessional roles. There's videos that offer insight into key elements needed to make peer-to-peer family engagement programs successful. The content is rooted in best practice and is available in a series of videos. The material is copyrighted by the National Technical Assistance and Evaluation Center for Systems of Care. So this is one example. So again, it's an abstract, it's a snapshot. It's meant to help you give a little bit of information, but you need to really click on the resource and take a closer look at the website to learn more. And here's another one on page 31 about understanding behavior in foster children. So this is from Foster Parent College, which is an online program. This training examines the function or purpose of behaviors and the underlying meaning of challenging behaviors. Also covered other ABCs of behavior and looking at parenting styles. It's designed for foster, adoptive, and kinship parents, as well as social workers and other professionals who work with foster parents. Foster parents and others who take the course will be able to list steps for understanding child's behavior, be able to describe surface behaviors, list 4 common reasons for behavior, describe the ABCs of behavior, and list 7 behavior trackers, and describe parenting styles and state the relationship to a child's behavior. So once again, this is another example. And here's another example through CEBC, which is designed for classroom training and incorporates didactic teaching methods and interactive exercises around vignettes. The training on average takes 1 to 2 hours to complete and includes completion of interactive exercises, handouts, and a review questionnaire. The registration cost for the training is $20 per person, and the course may be purchased in DVD sets, and it's copyrighted by Northwest Media, Inc. And one thing to point out, too, as we developed the toolkit, sometimes the cost was not evident or it was not made available on a website. Sometimes it was. So if a cost is listed, it means that we were able to access that information. If it's not listed, it means it wasn't available or it's something you need to research further with the source. So just wanted to point that out to you.
Right, and just to add on a little bit to what Kim just presented, as you go through each of those abstracts, 2 things. One thing I wanted to point out is that they are formatted identically. So the information that Kim said, it has the name and the title and then the developer's name and URL and so on. That list, going from top to bottom, left to right, those bullets in that previous slide, that's the exact order that you'll find it in. We did that on purpose to make it really user-friendly. So if you're comparing a few different possible trainings and you want to go directly to find out what additional information, if there's materials, it's going to include DVDs or what the cost is, you can go to the exact same place in each of those abstracts and find it. And so the other thing I wanted to point out is that as you go through the resources, the abstracts, you'll see that we organize them under the training topics so that you can go and see if you're looking specifically for a training around trauma-informed care. We didn't list them alphabetically or anything like that. We did it under the training topics, and so that's to make it extra user-friendly for all of you. Right, and then what we wanted to provide for you here is how you can access the toolkit if you haven't already accessed that. It's available at the CIBHS website at the link https://www.cibhs.org/toolkits. And I mentioned earlier about the expert work group and all of the wonderful subject matter experts that we had a chance to work with on this and did so much work for us. So I just wanted to do a shout out to all the agencies that they represented and acknowledge their hard work on this.
Okay, so at this point, we're going to open it up to questions from the audience. If you've not already typed your question, please type the question into the question box in the webinar control panel. If you can't find that or have difficulty doing that, you can email us at tfc@cibhs.org. So Kelly, do you want to read the first question that we have?
Yeah, so the first question is there a plan to have this training material translated to Spanish?
At this point, we understand there's not a plan to do that from DHCS.
And then the next question is, are the 40-hour pre-approved TFC training hours required on top of the 12 required RFA approval training hours?
I would let Cindy answer that question oh, I'm sorry, one more part of it.
Yes, and or can some of the RFA approval hours be applied if they meet the required TFC training topics?
The 12 hours are not included. A TFC parent needs to complete those 12 hours. However, the other 28 of the 40 pre-service hours can be used toward TFC parent training.
So it's 40 hours that still required, the 40 hours.
The 40 hours are still required.
Okay. All right.
And those are all the questions we have right now.
Okay. Anybody have any other questions? Feel free to type them into the webinar.
One more just came in. For agencies, do we need to apply, submit an application and program statement to DSS?
This is Teresa Castillo with DHCS. I'm not sure I quite understand the question. Can you, Kelly, can you please ask if they can elaborate on that?
Sure.
So the person that just asked that question, could you ask a little bit more detail? Could you enter that in, and we'll try to answer your question.
So they clarified to offer the TFC program, do they need to submit an application and program statement to CDSS?
I am not an expert in terms of what CDSS requires in program statements. I couldn't really answer the question. I would think that if an FFA agency will be providing TFC, that it would be included in the program statement. However, I am not able to answer whether they need to submit an additional or they need to revise their program statement. So that I wouldn't know.
Okay. And then I guess the question around the training hours is not quite clear.
Do you want to read the question again, the whole thing?
Yeah, and somebody asked another more clarifying, or see, I want to clarify the statement made about the 12 hours of RFA training potentially going towards the 40-hour expectations. From the response, it then appears to me that the TFC family needs a total of 52 hours. The RFA training does not count towards the 40 hours needed.
That is correct.
That is correct. Yeah, I guess that's not making a lot of sense to people, but I hope that clears it up. So it is 52 hours that they need.
Well, first and foremost, a TFC parent will be an RFA parent, so they will go through the RFA process to be just approved as a foster parent. The 40 hours required for TFC are meant to be as an additional 40 hours only for those parents that will seek to become TFC parents. The intent for that is that, as you can see from today's webinar, the training is specific to TFC. It is specific to providing a service It's focused around specific topics as was covered today. So the vision was that the 40 hours would be in addition to and after a parent is an RFA parent.
Okay. There's lots of questions coming in now about the 40 hours, so I just want to take a minute to make sure I'm getting these. Okay, someone said it doesn't make sense because the training is repetitive.
So I understand that, and again, this is Teresa Castillo from DHCS. I understand that and totally hear that in terms of topics that could be perceived as being repetitive. However, at this time, the policy that we've established is that it would be in addition, 40 hours additional training. I would honestly, I think that as TFC continues to be implemented, that's something that we could bring back and reconsider at some point. But right now, as we've established the policy, it's 40 hours in addition to being RFA approved.
Thanks, Teresa. Is there documentation training available for the foster parents to bill Medi-Cal?
Not at this point and not from the state. However, I understand that is something that foster family agencies will be working with the county mental health plan that they contract with. I understand that documentation training is something that that many, if not all, county mental health plans do for their providers. In this case, it would be the FFA, who in turn will be training TFC parents. So I would encourage that foster family agency to if you haven't already, pursue establishing conversations and communications with your county mental health plan to find out more information about the trainings that they provide. And I am addressing training on documentation, which I think it's part of the question. In terms of billing, the TFC parent will not be doing a specific billing. The billing will go through the foster family agency.
Okay, and then this question kind of speaks to that. Will counties need to contract with FFA to access, this is a two-part, TFC/ISFC resource parents? So you might want to clarify that those are two different services.
Kelly, can you repeat the question, please?
Will counties need to contract with FFAs to access TFC/ISFC resource parents?
So where I'm trying to understand is what agency, in terms of what counties mean in this question, if they are referring to child welfare agencies or mental health plans. A foster family agency, in order for a foster family agency to provide TFC services, they will need a contract for the county mental health plan. However, foster family agencies that also have an ISFC program, they do not need a county mental health plan contract for ISFC. However, I am not sure in this question what agency they are really meaning. So if they could clarify that.
Okay. Is there documentation training available for foster parents? Did we ask that already?
Yes.
Sorry about that. I'm kind of skipping here. Just, so somebody is asking about TFC and ISFC and whether or not they're the same. It is not the same. And if you need help with that, we just did a webinar on TFC and compared it to IFC. And that link is available in the email that you received early and will receive again after the webinar is over.
And I think, this is Kim, I think I would also add just to remember that ISFC is a placement, Intensive Services Foster Care is a placement. TFC is a Medi-Cal service, so they are two different things.
And then we have one more question here is, what is meant by a TFC resource parent? What is meant by TFC resource parent will not do the billing? And if somebody could clarify that.
So what I meant by that is that the TFC parent will not have access to any sort of claiming system, any sort of electronic system. So they will not be the direct billers to either the FFA or county mental health plan. Any claiming access to an electronic health records, anything like that will be conducted by the foster family agency, not the TFC parent, him or herself.
And this is Karen, to add on to what Vanessa just said, that the TFC parent will be responsible for doing a daily progress note. And so they will have to have documentation training on how to do the daily progress note that meets Medi-Cal billing requirements, and then have that signed by a licensed clinician. And then the step that Teresa is talking about in terms of actually submitting that and claiming for that is taken care of by the FFA.
To further clarify, TFC is paid at a per diem rate. And the per diem rate that's paid to the TFC agency for every day that TFC is provided, that per diem includes the payment that the TFC agency negotiates with the TFC parent, and it also includes the TFC agency's administrative costs and the TFC agency's staff costs, because the TFC parent works under the supervision of a licensed mental health professional or a registered or waivered mental health professional employed by the TFC agency.
Okay, another question here. In determining TFC, would that be a service that all group home children stepping down to placement be eligible for?
They could be. So TFC service, the TFC services are available for children and youth who are under the age of 21, Medi-Cal beneficiaries who meet medical necessity criteria for specialty mental health services. Of course, that determination would be made on an individual basis. However, children stepping down from group homes or STRTPs could be eligible and benefit from TFC services.
Okay, and here's a couple other questions about ISFC. So does the foster parent providing TFC service need to be an ISFC placement?
No, they don't have to be. They can be, but they don't have to be.
Okay, and does the foster parent providing TFC service, or can a resource family provide TFC service without being an ISFC placement? Yes.
Correct.
As an FFA, where do we start the process to offer TFC services?
Well, I would strongly encourage foster family agencies that are interested in providing TFC services to have communications with your county mental health plan. Also to research whether your county mental health plan has released a request for proposal or any other type of request like that. We know that many counties have released RFPs seeking interest or seeking responses from interested foster family agencies. So I would encourage that specific FFA who's asking this question to look into that. If for any reason you're having difficulty finding out that information, we can always assist with that too. So if the FFA wants to send us an email, we can also try to help with communications and reaching out to county mental health plan.
Okay, and is the agency expected to enter the daily notes into their EHR to Medi-Cal billing?
That will depend on the infrastructure of each foster family agency as well as the infrastructure of each county mental health plan, and how that, what agreements each FFA and county mental health plan will have in terms of how to do that.
Okay.
We know that the majority of county mental health plans have electronic health systems, but there may be some that don't. I mean, I'm not able to really speak to that, but I think it will depend on each scenario.
And so the next question is asking how the progress notes get submitted to DMH, or do they not get submitted?
Again, that will be something that will be arranged between each foster family agency and county mental health in terms of how that actually should occur according to each local infrastructure.
Okay, and then regarding supervision, will weekly resource parent supervision be allowed to occur in group setting or via Skype by the LMHP?
No, the licensed or waivered or registered professional needs to go to their home at least once a week. So it needs to be face-to-face, in person.
Okay, is there a length requirement for individual training topics, i.e. minimum number of hours that needs to be spent on cultural competency? Is there a length requirement for individual training topics? For example, minimum number of hours that need to be spent on cultural competency?
No, there's no, we're not dictating minimums or maximums.
Okay, regarding the daily progress note again, is there a standard daily progress note that has already been developed?
There's a sample progress note template, which is included in the Medi-Cal manual for intensive care coordination, intensive home-based services, and therapeutic foster care services. I believe that today's webinar did include a link to it, to the manual, so feel free to access the manual. We do have sample progress notes in the manual, as well as examples of completed progress notes as well.
And to add to that, in the Medi-Cal manual, in Chapter 5 are trauma-informed case history vignettes that track to case planning in Chapter 5, and these vignettes also track to the sample TFC progress notes that I believe are in Appendix B of the manual. Yes, they're in Appendix A, I think. No, they're in Appendix C, excuse me.
Okay, and we have a clarification regarding the question on TFC and ISFC resource parents. So meaning, will county entities oversee ISFC placements, or will those always need to go through an FFA? So I think this is on TFC.
No, I am not. I think I know what the question is asking, but which I believe is referring to whether county child welfare could place in a foster family agency that has ITFC or TFC. But again, that's not something that I think that would be a good question for social services for the placement aspect. Mm-hmm. If that is really what the question is getting at it. And I'm sorry that I'm just having a hard time following the specifics of that question.
Okay, back to the progress notes. Are the TFC progress notes part of the medical chart?
Huh. Interesting question. I would think so.
Okay. Is there a minimum amount of time the TFC resource parent has to document on a daily progress note?
No, there is no minimum or maximum. I know that other services are built on, for example, 15-minute increments. That is not the case for TFC. It is a per diem, only one progress note required. We're not establishing that it has to be at a minimum of X minutes. We're not, that is not the policy for TFC.
Okay. I think we are at the end of our questions.
And Kelly, for as well as for the our audience asking the questions, if there was a question that I didn't really understand, or if they would like additional clarification, I would like to invite folks to feel free to send us those questions via email, and we can do we'll do our best to provide further clarification, especially for the ones where they were asking about placement in ISSD.
Yes.
We can do some research to clarify those.
And just to point out, our last slide here lists several different email addresses which are available to you. So you're welcome to use any or all of those with questions. And if some come to CIBHS, we will forward them to the appropriate contacts at either DHCS or CDSS or both. And I want to thank everybody for listening to our webinar today. Like I said, this will be posted and it's been recorded. And we just also want to encourage you to take a few minutes to share your feedback as you exit this session. And so with that, I want to thank Karen Kurosaki, and I want to thank Teresa Castillo and Cindy Culkin and Kelly and Jerry at CIBHS. And we'll conclude our broadcast. And thank you again for joining us.